You're very welcome to my YouTube channel. This is your humble girl Nurse UB, and in my channel I talk about cancer a lot. I do a lot of cancer awareness on my channel here on YouTube, Nurse UB's Dex. Kindly subscribe to my channel if you're new to my channel, and if you're an old fan of my channel, you've been following me, you've been watching my videos, thank you so much. I'm super grateful, and I hope you've been getting information as you so deserve, and trust me, I'm going to keep dropping beautiful topics that you all would want and like to know. And in today's video, I'm going to be talking about how to detect a breast cancer, how to detect breast cancer on time, how to diagnose breast cancer by yourself. Okay, so we all deserve to know this. But I am not going to talk so much. I'm not going to do a lot of education. I'm just going to be talking about, I'm going to share stories. Okay, so the first story I'm going to share, I am an oncology nurse. I work in an oncology department of my facility, and I've been, I try to get close to my clients, my patients, to know how the whole thing started, how the whole journey started, what they saw, and how the experience was like. So, like, the first person I want to talk about here was Mrs. A. So I asked her, it's quite pathetic actually, that we always diagnose breast cancer in this other part of the world late, because a lot of people have a very shallow or no knowledge at all about breast cancer or about cancer. A lot of people still have a misconception about cancer being an evil disease, being, disease from the evil spirit or whatever. But we still need to tell people, okay? We still need to talk about breast cancer to people so that people will get to know about this. Today is actually, this month is actually Breast Cancer Awareness Month. October, we call it the pink month. So that's why I want to share this knowledge with us. So Mrs. A told me that it all started with pain. Okay, so I asked her, how was the pain? Did it just start like you felt so much pain? No, she said that it just started as a little pain close to her axilla. A lot of breast cancer start from the axilla. Okay, so because there are a lot of lymph nodes there at the axilla, this is the armpit region. That's what I mean by axilla. So she said it started as pain, and then but she was like, okay, she went to a close by pharmacy or chemist or medicine shop, whatever. So they told her, okay, that she can just take an analgesic and it will go off. So they placed her on analgesic, and the pain, the pain relieved, or it went off, and she didn't really feel that pain anymore. And then she thought everything was over until it was about like 6 months later, and by that time she already started noticing that the texture of her breast, the texture of the skin of the breast was changed. Okay, she started noticing there was a dimpling, there was rashes all over, and then that was how she knew that there was a problem. And then the pain came back, boom, and then she came to the hospital, and that was when she was diagnosed. After surgery, she was diagnosed with breast cancer, and by that time it was already very late, and that was like almost 8 months to 1 year. So now we talk about Mrs. B. I asked her, okay, ma, how did this whole journey start? What happened? Did you feel pain? Because I've always, I'm always very inquisitive, I want to know. I'm always very curious when I see my patient in pain and in so much distress. No, Mrs. B said it didn't start like pain, but she noticed a lump in her breast and asked her which side of the breast. She said it started at the left side of the breast. Note. Okay, so she said she felt a lump at the left side. I asked where exactly. She said it started at the quadrant, very close to the armpit. So when I asked her, she said she felt the lump, and then she told her husband. So her husband was like, okay, that she knows somebody at home. Her mother actually can take her to somebody that could help her, probably give her something, maybe herbs or something, to help to probably to dissolve the lump. Okay, that's the very feeble knowledge that people have. Herbs doesn't really take care of cancer or breast lump. It might disappear, just like Mrs. B said. It actually disappeared when she started taking the herbs. She started drinking a lot of herbs. They placed her on herbs. She even had to travel to a local place for that to happen. So when the lump went off for about a period of time, she said After about a while, like a year and a half of her diagnosis, the lump came back. And then she was just feeling, because the lump was painless. Actually, it wasn't painful, but she was just curious, like something is wrong. Okay, so that was what happened to Mrs. B. All right, so you see stories, different stories. And then another person, I saw this. I like to use Mrs. C this time. So Mrs. C was like, okay, my breast was okay. It was very normal when I was pregnant. It all started when I gave birth to my third baby, and it was a baby girl. So I asked, what happened? What actually happened? She said that the breast milk, it started as breast milk. She noticed that for a while the baby was sucking, then the baby stopped sucking, and that's a problem. That's an indication that there is a problem. So she then tried to forcefully put the baby to breast. The baby refused to take breast milk because there was a problem. Then she noticed that the breast milk it started looking bloody or dark brownish. So it troubed her that she really wanted to get to know what was the problem. So she went to the hospital, and then they told her that she has to go through various scans, various tests. So it was delayed because it was a facility that didn't have a very good knowledge about breast cancer or anything. It wasn't even a gynecologist that she saw. So before she was referred to a proper facility, it was already late, where they had to do a surgery, a biopsy. They took tissue from the breast to figure out what it was. So they then find out that it was a breast cancer that was coming up. So Mrs. C is being treated. She's becoming better because it was a bit early for her, but then she's still under treatment. And then coming to talk about Mrs. D. Mrs. D told me that she was not breastfeeding. She was not breastfeeding. She didn't have any problem with her breast. She wasn't having any pains. But all she noticed was that there was a discharge coming out from her nipple. So I asked Mrs. D, I'm like, okay, so if you found out that there was a discharge, you went to the hospital. She said, yeah, that she didn't go to the hospital because she was thinking that it's probably, maybe it's a cycle. Okay, so and then she went to somewhere where they gave her something. They think it's normal breast discharge, probably is male, because she is a mother, but she's not a nursing mother. She's not supposed to have breast milk. So they started giving her something, thinking that probably is from the previous baby that she had, that's why she's maybe breast milk is coming out again. So she said they started giving her medication, injections to stop it, and then for a while it stopped. But then later, boom, it came back. So these are the different symptoms. These are the different early signs, early warning signs of breast cancer. I've talked about pain. I've talked about a lump in either side of the breast. I've talked about breast milk change if you're breastfeeding. I've talked about a discharge from the nipple. Now, come on, let's talk about dimpling of the nipple. If you have your normal breast, okay, all of us know how our breast is. I know the size of my breast. I know the shape of my breast. I know the outlook. I know everything about my breast. So coming on one day, I now figure out that something is wrong. Probably there is something that is not normal. I will know. So that's when you talk about the likes of dimpling of the nipple, or you talk about the sizes of the breast changes in breast size. Probably one side become bigger than the other side, abnormally bigger. Normally, okay, we know that one side of the breast is always a little bit slightly bigger than or larger than the other side. But when it becomes abnormally large, that you know that there is something wrong, definitely I will urge you to report to the physician, so that we will caught breast cancer early, and we will try to have early diagnosis, so that we will tackle breast cancer when it's coming up. Okay, so if you like to know other things, we talk about rash. I mentioned rashes. I mentioned peel the range. That's you have dimpling of the skin. Like you see, you know how the orange peel looks like, the back of an orange look. You know how it definitely look like. So you see a part of your breast becoming dimple. It's not normal. So you should report to somebody. Thank you very much for staying with me. If you have contributions, always find time to drop them down in the comment section. And if you have any questions, do ask any question down in the comment section. And don't forget to go to my Instagram handle, Diagnose on Instagram. You see me, you can always DM me, and you can even drop your own whatever any topic you want me to treat, and I'm going to handle. Next time we come, I'm going to talk about how to examine your own breast by yourself.